When it comes to managing psoriatic arthritis, PSA, one of the most common questions people ask is whether a specific diet can cure the condition. While no diet has been proven through scientific research to completely cure PSA, there are ways that dietary choices can influence the severity of symptoms. In fact, a balanced, nutritious diet can help control weight and reduce inflammation, which are key factors in managing PSA. In this video, we'll explore the relationship between diet and psoriatic arthritis, examining which foods may help alleviate symptoms and which ones could potentially worsen them. Let's begin with the importance of maintaining a healthy weight. Extra body weight places added stress on joints, particularly those in the knees, hips, and lower back. For individuals with PSA, carrying excess weight can increase the severity of joint pain and inflammation. More importantly, being overweight or obese also raises the risk of developing psoriasis, and it can make existing psoriasis symptoms worse. Therefore, shedding those extra pounds is beneficial not only for overall health, but also for reducing the burden on affected joints. This makes losing weight an essential part of managing PSA. Now, let's talk about fats. When managing PSA, it's not just about cutting out fats entirely, but rather about choosing the right types. Research suggests that certain healthy fats can reduce inflammation and even help improve PSA symptoms. For example, monounsaturated fats, found in foods like olive oil, avocados, and nuts, have been linked to reduced symptoms such as pain and swelling. These fats are known for their anti-inflammatory properties and can benefit cardiovascular health, which is often a concern for people with PSA. Another group of fats that have garnered attention for their anti-inflammatory effects are omega-3 fatty acids. These fats are found in fatty fish like salmon, sardines, and mackerel, as well as in fish oil supplements, flax seeds, and walnuts. Studies suggest that omega-3s may help reduce joint inflammation and improve overall mobility. For those with PSA, incorporating omega-3-rich foods into the diet could offer relief from swelling and pain associated with the condition. On the flip side, not all fats are created equal. Saturated fats, which are primarily found in red meat, full-fat dairy products, and processed foods, can worsen inflammation. These fats are also known to increase LDL bad cholesterol levels, contributing to cardiovascular problems. For individuals with PSA, consuming too much saturated fat can exacerbate symptoms and increase the risk of other health issues, such as heart disease. Therefore, it's wise to limit saturated fat intake, opting instead for healthier alternatives. So, does weight play a role in the severity of psoriatic arthritis? The answer is yes. Extra weight increases stress on the joints and can amplify pain and inflammation. But the link between weight and PSA extends beyond just physical strain. Research indicates that being overweight can also worsen psoriasis, the skin condition often associated with PSA. By losing weight, you not only reduce the strain on your joints, but also potentially decrease the frequency and intensity of psoriasis flare-ups. Next, let's tackle the question of whether specific foods trigger PSA. While there is no concrete evidence linking certain foods directly to PSA flare-ups, some people report that certain foods seem to worsen their symptoms. This may vary from person to person, as individual food intolerances can sometimes exacerbate inflammation. However, scientific research on this matter is still evolving, and more studies are needed to draw firm conclusions. That being said, adopting an anti-inflammatory diet is often recommended for those managing PSA. So, what exactly does an anti-inflammatory diet look like? Essentially, it involves eating foods that help fight inflammation rather than fuel it. A typical anti-inflammatory diet includes plenty of fruits and vegetables, whole grains, lean proteins like fish and nuts, and healthy fats like olive oil and avocado. This kind of diet is rich in vitamins, antioxidants, and fiber, all of which support immune function and reduce inflammation in the body. Additionally, an anti-inflammatory diet helps maintain a healthy weight, which is crucial for managing PSA. While there are no foods that have been definitively proven to worsen PSA, some individuals report feeling better after avoiding certain items. For instance, nightshade vegetables, such as tomatoes, potatoes, and eggplant, are often blamed for triggering inflammation in some people with PSA. These vegetables contain solanine, a substance thought to promote inflammation. However, there is no solid evidence proving that nightshades directly affect PS symptoms, and they actually contain important nutrients like vitamin C and vitamin A. So, unless you're personally sensitive to them, there's no need to eliminate these nutritious foods from your diet. Acidic foods, such as citrus fruits, tomatoes, and even coffee, are sometimes said to increase inflammation. However, it's important to note that arthritis is not caused by consuming acidic foods, and many of these foods are high in vitamin C, which is beneficial to the immune system. Cutting out foods like oranges and lemons may do more harm than good since they're packed with essential nutrients. Dairy products also come under scrutiny in discussions about PSA. Some people believe that dairy can exacerbate inflammation due to the acid it contains. However, there's no scientific evidence to support the claim that dairy products cause arthritis. In fact, dairy is an excellent source of calcium and protein, both of which are important for bone health, something people with PS should be especially mindful of, as they are at an increased risk of osteoporosis. If you're concerned about dairy, opt for low-fat or non-dairy alternatives, such as almond or soy milk, which can help maintain a healthy weight and reduce inflammation. When it comes to meat, there is mixed evidence about the impact of vegetarian diets on PSA. While eating more vegetables and fruits can increase your intake of vitamins and antioxidants, some people find that cutting out red meat helps reduce their psoriasis symptoms. Red meat contains certain acids that may increase inflammation, but a strict vegetarian diet may also mean missing out on essential nutrients like iron, zinc, and vitamin B12. A balanced approach, focusing on plant-based foods but including occasional lean meat, might be the most sustainable for managing PSA. Food intolerances are another factor to consider. Some people experience gastrointestinal issues after consuming certain foods, which may be linked to food sensitivities. If you suspect that a particular food is affecting your symptoms, it's best to consult with a dietitian or your doctor. They can help you identify any intolerances and develop a plan that ensures you're still getting the nutrients you need while avoiding problem foods. Finally, let's talk about alcohol. The relationship between alcohol and PS is not well established, but some studies suggest that alcohol can increase the risk of developing PS in individuals with psoriasis. Alcohol can promote inflammation, potentially triggering flare-ups and exacerbating symptoms. It can also interfere with medications and increase the risk of liver damage. Keeping track of your alcohol consumption and noticing any patterns in your symptoms may help determine whether alcohol is a contributing factor to your PSA. In conclusion, while no diet can cure psoriatic arthritis, a balanced and anti-inflammatory diet can help manage symptoms and improve overall health. Choosing healthy fats, maintaining a healthy weight, and avoiding foods that may trigger inflammation are all key components of managing PSA. If you're unsure about which foods are best for you, it's a good idea to consult with a dietitian or healthcare provider who can offer personalized guidance. By adopting a healthy eating plan tailored to your needs, you can take control of your PS and lead a more comfortable, active life. If you found this video helpful, don't forget to like, share, and subscribe for more tips on managing psoriatic arthritis and living a healthy lifestyle. Thanks for watching, and take care of yourself on this journey to better health.